Hey folks, welcome to the another episode of the ongoing drama series, the Friday COVID Brown Bags. Welcome to the another episode of the sorry, those feedback. So, okay, so lots to cover today. A ton of news came out. Things have changed quite a bit in the COVID landscape in terms of the science and what we understand about the disease and the dynamics of the disease. So tons to go over. As usual, this is going to be on Facebook Live, as well as recorded on YouTube for upload later on. So if you can't make this live, then there'll be several options to watch it recorded. As usual, if you are on Facebook and you want to join in on the Zoom chat, please DM me. I'll try to get you the link. Otherwise, you can try to put up the questions on the comment section in Facebook, and I'll try to get to them. And if you have comments or questions on Zoom, please feel free to speak up or raise your hand or put it up in the chat. Okay, so like I said, lots to cover, so let's get started. Oh, sorry, I don't know why I have this little bubble on there. It's a screen capture off the New York Times. But right now, global numbers are not looking great. You can see that the global numbers are still rising. We are up close to about 600,000 new cases a day. We're not at the peak that we saw just a few months back, but that was, of course, largely driven by the India outbreak. But we are getting closer to that point. We also have seen about 9,000 deaths a day. Again, with deaths, especially at a global level, keep in mind that this is probably a significant underestimate. You may want to multiply that number by 2, 3, 4 fold, maybe even more, to get the accurate number of deaths. The hotspots. So right now, again, this game of whack-a-mole continues. Numbers in South America are now going down finally after a sustained period where they had some very, very high levels. Numbers in South Asia are also down after their huge peak just a few months ago. However, numbers in North America are now on the rise, as it is in Europe, in Africa, particularly northern and southern parts of Africa, and Southeast Asia, as well as East Asia, are seeing an increase. In fact, the Asia numbers are now being driven by Indonesia, and there's some worrying numbers out of Japan and South Korea as well. So again, it seems like as numbers go down in one region, it flares up in another area. So let's look at the details as far as countries. So these are actual case numbers. The U.S. is up, of course. South American numbers are going down. They're still at a high level, but they're trending in a positive direction. They've been trending in the positive direction for the last 2 weeks. So that's some good news for a region of the world that has really seen some tough times during this pandemic. The numbers in Africa, probably an underestimate, but there's some worrying numbers coming out of Africa, particularly the southern part of Africa. As I mentioned before, East Asia, there's some increases, particularly in Japan. Southeast Asia, there's some really worrying numbers coming out of Thailand and Indonesia and Malaysia. And in Europe, well, we'll talk about Europe because some really interesting numbers coming out of the UK. However, there are some worrying numbers coming out of Germany, France, Spain, and Portugal. So Europe numbers are now starting to go up. Eastern Europe is still quiet, but we'll see. The trend has been that as Western Europe goes, Eastern Europe will follow. So we'll see how that goes. In terms of continents, regions, Asia is number one in terms of raw numbers of cases, which is to be expected given the population. And again, this is largely driven by Southeast Asia, particularly Indonesia. Indonesia numbers are really looking bad right now. And Indonesia, remember, is the fourth most populous country in the world. So there's it's really spread out. Their public health system is being overwhelmed. So those numbers are very, very concerning. European numbers have seen a dip. and that dip is largely driven by the dip in the UK, which we'll talk about in a little bit. However, other parts of Europe are seeing increases, particularly on the continent, France, Netherlands, although the Netherlands has seen a dip too. Netherlands, Spain, Germany, Italy. So the rest of the continent is starting to see increases. North America is now exceeding South America for the first time in a long time. Like I said, driven largely by the US. Africa numbers, although that seems at a low level, again, my guess is that this is a significant undercount of what's actually going on in Africa. They just simply don't have the testing right now or the public health infrastructure to report the numbers. And even in Australia, you're seeing a bit of an increase. So in terms of cases per day, the US has taken over number one again. If you recall last week, we were down fourth or fifth. We are now number one. And that's how bad the surge is in the US. We are now almost 20,000 more cases per day than Brazil, more than Indonesia, more than India, the UK, Iran. So you're seeing a lot of European countries here now. It used to be dominated by South America. You're seeing some European countries, the US, as well as some countries that you have not seen on this list before. For example, Malaysia or Thailand, Vietnam. These are countries, Japan. These are countries that have done an extraordinary job. Thank you. Just need my coffee. My lovely assistant, wife. Anyways, you're seeing a lot of countries that have done an extraordinary job controlling the pandemic up to this point. And you're seeing some increasing numbers, and that is really concerning on multiple levels. So as far as per capita, this list is still dominated by Europe and South America, with Cuba, Botswana, and a few other countries in there. Georgia seeing high numbers. From a per capita standpoint, South America still kind of is leading this list, although again the trend is in a positive direction. Europe's numbers have dipped because of the dip in UK numbers. North America, however, we're going up again, driven largely by the US. So our per capita numbers are looking great either. And my guess is by next week, we will be the number one country, number one region in terms of per capita cases per million. Asia numbers, again, you're seeing a slight uptick. Africa numbers, again, think it's probably an underestimate. And even New Zealand and Australia are seeing some increases. Not New Zealand, but Australia. I'll show you those numbers in a bit. In terms of individual countries, the top 25, it's led by three smaller island countries, Cyprus, Fiji, and Seychelles. Cuba is struggling right now with numbers. They have a fairly significant surge, probably driven by Delta. Georgia has seen a huge increase. Georgia, of course, is a small country in the Caucasus region. Oh, sorry, Caucasus region over by Turkey. Botswana, that's really concerning. Again, given the lack of resources in that healthcare resources in that country, that is a seriously high number. Spain, Malaysia, the UK, Mongolia is still struggling. So these are the countries that kind of lead in top in per capita rates. And you can see the changes here. You're seeing mostly positive trends in South America, with the exception of Brazil, which saw a little bit of an increase. Brazil just is still kind of at a steady high number. So there's still, yeah, most of it is going down a little bit, but not to the degree that you'd like to see it. North America, of course, is seeing a surge. Europe is seeing a surge, with the exception of the UK. You can see the surge in Africa and the northern parts of Africa, as well as central parts of Africa, and Southeast Asia and East Asia as well. So you can see the South Sudan saw a significant increase. They have very, very small numbers, so this increase might seem significant, but really they have small numbers. Again, lack of reporting, infrastructure, that's probably hampering their reporting efforts. Oman saw a big increase. Oman's a little interesting in that region, because that region actually has fairly high vaccination rates, okay? Since they are, relatively wealthy, with the exception of Oman and Iraq, unfortunately. Most of those countries that have fairly high vaccination levels, with the exception of those two countries. You can see that there are some countries, Iceland, there's unfortunately, a lot of African countries on this list, which is really, really concerning. So yeah, these are the countries that are seeing the most increases. So I want to look at region by region like I have been, and I'll go through this fairly quickly. Canada numbers have started to increase a little bit, but not to the degree of the US. These are cases per million. So the US is now about 200 per million cases per day, which is about the level that we saw back in February. So not a great trend. Now, this is also, we'll go over the US numbers. This is also very regional as well. But this is really what's driving the North American surge. This is Central America and the Caribbean. You can see that Cuba is really struggling. And that graph is still going straight up. So they're really struggling with a significant surge. Excuse me. Costa Rica's and Panama's numbers are trending at least positively. Guatemala is seeing a bit of a surge, as well as Honduras and Mexico. Dominican Republic seems to be doing okay. But Cuba really is the story. They're really, really struggling with a significant surge. South America, like the positive trend is continuing with a few exceptions. You see that Argentina has a slight uptick. Same with Colombia, but most of the continent is doing okay now, which is, again, given their high levels for so long and the struggles they've had, this is really, really positive news coming out of South America. However, the southern parts of Africa is there's a few countries that are seeing declines, but there's also some countries that are seeing increases. Botswana is seeing a significant surge, 700 per million. That's very, very high, especially for a country that lacks the resources to deal with the clinical aspects of COVID. Again, they're running out of oxygen. They have very few ventilators. They have very few recourse for symptomatic cases. So I'm afraid that, and they have very, very low vaccination rates. So I'm afraid that we're going to see a surge in deaths in these countries as well. But positive news, Namibia and South Africa are seeing some declines, as well as Zimbabwe, but Mozambique and Eswatini are also seeing surges. So it's kind of a mixed bag in the southern parts of Africa. In Central Africa, Rwanda has the high numbers in central part of Africa, but I think that's partially due to the fact that Rwanda actually has a fairly robust healthcare system, and so they have some good reporting of numbers. I think the numbers are much higher in these other countries, but again, lack of resources is preventing them from testing and reporting these numbers out. But you're seeing you see Nigeria's numbers, they seem very low, but I think that's probably a significant underestimate, because they also have one of the lowest vaccination rates in the world. I'll go over the low vaccination rates. Ghana is seeing a surge. Senegal, Gambia have seen surges. So a few of these West African countries are seeing a surge as well. Probably Delta, although it's really hard to say because, again, lack of genetic typing in that region, because lack of resources. Northern Africa, Libya was doing well, and then they're seeing another surge there. Morocco seeing a surge. Algeria, Egypt's doing okay, but again, Tunisia is down after their big surge, but it seems like it's their downward trends paused. Again, I want to see see where their numbers are next week to see if these trends will continue. The Middle East, Iran seeing an increase, Iraq seeing an increase, Kuwait's doing better. Israel is seeing a concerning increase. And of course, that's concerning because they have some of the highest vaccination rates in the world, particularly with the mRNA vaccine. Israel used almost exclusively the Pfizer-BioNTech vaccine. So to see their surge is a bit concerning, given that 70% of their population almost 70% of their population is fully vaccinated. And seeing a surge like that, mostly Delta, is concerning. We'll talk about that in a little bit. Let's see. Central Asia, I mentioned Georgia. Mongolia numbers have gotten better, but Kazakhstan has seen an increase. Same with Turkey is seeing an increase, and Azerbaijan. So, yeah, it just seems like we get control of the disease in one region, and it just increases in another region. South Asia, for the most part, doing well. Sri Lanka and Nepal have kind of plateaued at a level higher than we'd like to see, same with Bangladesh. But India numbers are continuing to look good. Pakistan seeing a little bit of a surge. Bhutan's doing okay. So South Asia really has, after the horrors of just a few months ago, things have settled down in South Asia. However, Southeast Asia is now driving the surge in Asia, particularly Indonesia, Malaysia, Thailand, Myanmar. There's some really concerning news out of Myanmar. Of course, there was a coup there, a military government. There's some reports that the military government is using medical resources to reward their supporters and punish their opponents. And that's highly disturbing. But Vietnam, the concern about Vietnam and Thailand is that they've done such a phenomenal job of controlling COVID for as long as they could using just, good public health. But again, as I mentioned before, masks, social distancing, shutdowns, those are temporary tools. Eventually, you have to get vaccines distributed. And because they lack the resources to buy the vaccines, this is what's happening in those countries. So it's really just sad to see that, because they've done such an amazing job of controlling the pandemic up to this point. But Thailand's seeing a huge surge, as is Vietnam. East Asia, they have less of an excuse, quite honestly, particularly Japan, given that they knew they were having the Olympics. They're a wealthy country. They could have gotten the vaccine, and they failed to. And now they're seeing a significant surge when all eyes are on the country because of the Olympics. Anyways, you see those numbers. It's going straight up. They're in the midst of a serious surge. And they're probably going to exceed the highs that they saw just a few months ago. South Korea numbers have kind of plateaued, about half of Japan's numbers right now. We'll see where South Korea's numbers are in a little bit. South Korea is really expanded their vaccination efforts, so we'll see if that takes hold. Taiwan, they had a bit of a surge. They've done a really good job controlling it. China, numbers out of China, they're not really reporting it. I know that there is, Nanjing is seeing a surge of, a significant surge of Delta cases. We'll see how they deal with that. So China, again, it's a huge country. They're not going to be immune to these surges with Delta, particularly with a variant that is that much more transmissible. It's China. We'll need to keep an eye out on China. China does have some, is really vaccinated their population, but we've seen what's happening with Delta, even with highly vaccinated countries, vaccinated with highly effective mRNA vaccines are seeing surges. So we'll see. It's what I mentioned about Australia. Now, again, keep in mind, you look at the y-axis here, it's 7 per million. We're looking at other countries that's 700 per million. So we have to keep that in mind. But this is concerning for Australia, given that they've had this under control for such a long time. But again, it doesn't take much for, especially Delta, we're talking about an R naught of double that of Alpha, to really spread very rapidly. And that's what's happening in Australia, in Sydney. A few cases got in and is now spreading fairly rapidly within Australia. So really concerning there as well. Again, keep in mind that, yes, it looks really high, but if you look at the y-axis, it's a much lower level than, say, Southeast Asia, where we're looking at 400, 500 cases per million. Europe, I split out between Western and Eastern Europe. Spain seems like things have plateaued. Good news. UK is just went up, and I'll talk about the UK in a bit. It's because it's really, really curious, and a lot of us are really wondering what's going on. France is seeing a surge. Portugal's numbers have stabilized. Netherlands is also kind of dipped a bit after a surge, kind of along with the UK. Denmark saw a surge, went down. and Germany's seeing a little bit of a surge. So Delta is starting to spread in the continent, which was inevitable given how transmissible Delta is, and given that a lot of European countries have started to relax their restrictions. And this is Eastern Europe. Things are pretty quiet in Eastern Europe. Greece, I know some people don't count Greece as Eastern Europe. I'm looking at Eastern Europe strictly as a geographic region rather than a geopolitical region. So please forgive me if some of you folks don't consider Greece Eastern Europe, but whatever. Russia is still at a high levels. Russia's struggling because there's so much hesitancy, so much vaccine hesitancy in Russia, even towards their domestically produced Sputnik vaccine. And I think it's just a reflection of a deep level of distrust in their centralized government, which is something that we're kind of going through as well. And we don't talk about that much, but distrust in centralized government makes public health really, really difficult. But so far, looks like Lithuania is seeing a bit of a surge. Finland is seeing a surge. My guess is that we will see a surge in Eastern Europe because of Delta. Not to the degree that we saw, for example, Czech Republic saw some horrific numbers over the winter. I don't think we'll see those numbers and deaths, but I expect to see a surge. So here's a little summary of my global observations on incidents. So overall, worrying increase in incidents driven by the Delta variant, again, much more transmissible. Asia has the highest numbers, driven mostly by Indonesia, but South America still has the highest per capita rates. Incidence is increasing in Western Europe, North America, Southeast Asia, East Asia, Southern and Northern Africa, and Oceania, but it's declining in South America and South Asia, thus the whack-a-mole. And there's a notable decline in the UK, which I will talk about in a bit. As far as deaths, we have now exceeded 4 million deaths. Again, I think you probably have to multiply that by 5 or 6-fold to get real numbers on deaths. Because this is really grossly underestimated. And it probably won't get a good handle on the total death toll from COVID until, in the next few years when we look at excess deaths. We are now at about close to 9,000 deaths per day globally. Okay. We'll see how deaths go. Again, deaths will surge in countries with low levels of vaccination. So in Africa and Asia, you're going to see surges in deaths. However, in Europe and in South America, regions with higher levels of vaccination, I don't think you'll see a surge in deaths. Mainly because those vaccination campaigns have really targeted those at highest risk for hospitalization death. So death tolls should be declining in general. However, again, in places like Africa that have really low vaccination rates, we may see high levels of death. As far as number of deaths, Indonesia and Brazil are still leading the way in counts. Asia is leading the way, again, driven by Indonesia. South American numbers are getting better. Europe, Africa, and North America are all seeing an uptick in deaths. Again, will we see the number of deaths we saw over the winter? Probably not, given that, again, in Europe and North America in particular, the high levels of vaccination, or relatively high levels of vaccination, particularly among those at high risk. Indonesia now leads the way, 1,500, 1,600 deaths per day, probably an underestimate. Then Brazil, Russia, Indonesia, Mexico, Myanmar. So US is a little bit further down on here. And I don't expect our deaths to really get super high, again, because we vaccinated so many of our seniors. Even in states with low levels of vaccination, if you look at the over 65 population, they're typically, 70, 80, some cases over 99% of that population is vaccinated. In terms of per capita, South America and Southern Africa are kind of leading the way here, along with Indonesia and Russia. Again, South American numbers are declining, but for deaths per million, they still lead the way. North America has now exceeded Europe in terms of deaths per million. then Asia, Africa, and again, not even Australia and New Zealand are immune to Delta right now. In terms of countries, Namibia, this is really concerning. This is really concerning. Namibia, country bordering on South Africa, very poor country. It's not again with very low vaccination rates. So this isn't unexpected that they have such a high mortality right now. Same with Tunisia. Tunisia has more vaccinations, and they have, I think France and Europe are because it's a former colony, are providing more aid, but still very high. Fiji, small country in the South Pacific, very high. Botswana, Oman. So you look at these countries, and these are countries that can least, I mean, they just don't have the clinical resources to deal with surges like this. So that's why you're seeing such high mortality. Colombia, Argentina, Myanmar, Cuba, Seychelles, Indonesia. Okay, you don't see any countries in Europe here or North America. So in terms of deaths, increases death in North America, Southeast Asia, parts of Africa, Europe, particularly Western Europe, and even Australia. I think this is a bit of a wake-up call to a lot of folks that Australia, which was doing so well, is seeing a bit of a surge here. Okay, in terms of increases in deaths, you're seeing a lot of African countries here, a lot of African countries with some European countries mixed in. It's very concerning. Again, these are also countries with very low levels of vaccination. So their at-risk populations are not protected. And you're talking about a variant that spreads far more quickly and is possibly leads to increased hospitalizations. Although the data on that still to me is unclear. So again, reported deaths are still lagging. So we're still seeing a surge. So deaths are still probably lagging. And they're also grossly underestimated, especially in the Asian Africa. So you have to keep that in mind when you look at deaths. You know, again, recent studies out of India showed that during their last horrific surge, their death numbers were underestimated by a factor of 10. So that's really, so keep that in mind when you look at deaths. We're seeing increasing deaths in Africa and Asia. We are seeing increasing deaths in North America and Europe, given that we are seeing a surge, but at much lower rates. And again, given the vaccination rates in those regions, I don't expect deaths to get as high as we saw during the winter surge. Because again, most of their at-risk populations are protected through vaccination. But we are going to see increases in deaths because of breakthrough infections, because of unvaccinated folks. Okay, deaths are declining in South America, but it's still significantly higher mortality rate than the rest of the world. And again, areas with higher vaccination rates, yes, we may see surges with Delta, but we probably won't see significant surges in hospitalizations and death because of the vaccinations. Okay, so in many ways, this is globally, this is a tale of two pandemics. Among the vaccinated populations, we're going to see among the vaccinated countries, we're going to see surges in cases, but we probably won't, and we'll see surges in deaths and hospitalizations, but not nearly as high as surges in deaths and hospitalizations in countries with low levels of vaccination. This is further exacerbated by the fact that those countries with low levels of vaccination just don't have the clinical resources to deal with surges and hospitalizations. And so you're going to have higher mortality simply because they just don't have the clinical facilities and clinical resources to deal with serious cases. They don't even have the oxygen. So as far as vaccinations, we are now in excess of 4 billion doses administered. But that's translating only to about 2 billion folks in the world with at least one dose, right? And that's only maybe 27, 28, approaching 30% of the population with one dose. So we still have a really long ways to go. These are the countries, top 25 countries in terms of vaccination rates. Focusing on first dose. These are ranked by one dose, at least one dose. Iceland is number one. They're about 78% with one dose, 74% with two doses. Iceland is a small island country, of course, so vaccination in those countries are typically a little bit easier than in large countries. UAE second, Seychelles, Uruguay, Singapore, Chile, Denmark, Canada. I just want you to notice that the US is not on this list anymore. We are not in the top 25 anymore. I don't think we're in the top 30, actually. I should look at that. We are much further down than a lot of these countries. But you notice there are no African countries on this list. Very few Asian countries. The Asian countries that are in it, mostly very wealthy Asian countries. A few South American countries, but yeah, you can see a trend here. But again, the good news is, wow, there are countries with 72%, 80% of their close to 80% of their population with one dose, 75% of their population with two doses. But even there, you're seeing surges with Delta. Yeah. You look at some of these countries. Iceland has seen an increase. Seychelles is still struggling. Uruguay is looking good. Singapore is seeing a bit of a surge. Chile is looking good. Denmark saw a surge. Canada is doing okay. The UK saw a huge surge. Same with the Netherlands. So again, things have changed with Delta. So even countries with high levels of vaccination, with highly effective vaccines, are still seeing surges. This is the other end, and this is just it's gross. Look at the scale here. You look at the scale here. We're talking 70%. We're looking at 2% here. So you're thinking, oh, hey, Uganda's doing great, except no, they're looking at about 2.5% of their population with one dose. And then you look at these countries; they are all just about all in Africa or Asia, with the exception of Haiti, which, of course, Haiti. Yeah. So this is the problem. So you got countries that have less than 0.1% of their population with one dose. Even the most vaccinated country in this list only has 2.5% of its population. Again, Africa, Asia, Africa. Oh, Asia, sorry, Yemen's Asia. Papua New Guinea, Africa, Asia, Africa, the Caribbean. So, in terms of region, Europe is now leading the way in terms of having share of people receive at least one dose. Then North America. That's mostly driven by Canada. It's not the US. South America is quickly catching up. They have been vaccinating like crazy. The concern is that they've been vaccinating with less effective vaccines. But right now, any vaccine is better than no vaccine. Asia is starting to catch up as well. Australia and New Zealand is finally catching up, but Africa is just lagging. You can see the issues right now with Africa. And again, if you look at vaccines doses, proportional, looking at the proportional population, it hasn't budged either. Looks like about 1 or 1.5% of the vaccines administered around the world are going to Africa right now. The vast majority are going to Asia, and then Europe, North America, and South America. And then if you look at the income, low-income countries, not even 1% of the vaccines are going to low-income countries. If you look at that previous list, those are all very low-income countries. So vaccinations. I think the biggest takeaway is the significant regions of the world still do not have access to the vaccine. This will bite us in the ass. I mean, from a human rights standpoint, of course, this is just wrong on so many levels, but it's going to, if you are concerned more about, okay, well, how is it going to affect us? The more virus circulates, the more likely variants are going to happen. No one's safe until we're all safe. So this is going, again, I sound like a broken record. This is something that we need to address before the next pandemic. Equitable distribution of vaccines. Okay. Second point I want to make, many European countries have now exceeded the US in vaccination rates. We have lagged significantly. A lot of European countries and quite honestly, South American countries as well and Asian countries are now exceeding the US in vaccination rates. Remember, way back in February, Europe was being criticized heavily because their vaccination campaigns have lagged. They have now caught up and exceeded us. Our vaccination rates have completely stagnated. We're not even in the top 25 countries anymore, okay? And also wealthy countries that did not prioritize vaccination now seeing significant surges. So Australia, Japan, South Korea, they did not prioritize vaccinations because, I don't know, they got complacent because their public health measures were doing so well. In fact, we celebrated these countries for doing such a good job. Well, this is what happens. You cannot rely on those measures. Those are temporary measures. Social distancing, mask wearing, mandatory shutdowns are short-term measures. They will not, you can't impose them for an extended period of time. You have to get people vaccinated. They didn't do that. In Japan in particular, there's just no excuse for that. Let's talk about Britain. Okay, so situation in Britain, huge surge, mostly driven by Delta. Huge surge. And this wasn't helped by Euro Cup and vacationers. And then Prime Minister Boris Johnson announces Freedom Day when he removes all restrictions on all COVID restrictions. And all of us said, boy, they're going to see a surge. It's going to be bad. It's going to be worse than what they saw over the winter. And then this happened. And honestly, I like being wrong. I think in most cases, epidemiologists are like, yes, I'm glad I'm wrong. But we're still wondering what the heck happened. Because this just about coincided with Freedom Day. When, all of a sudden young people were packed in pubs and they were going to parties and all restrictions were removed. We thought, oh my gosh, we're looking at Delta, far more transmissible. It's going to spread like wildfire. And this is happening. So there's a lot of theories here. One is, well, maybe it's because Euro Cup is over. All the soccer folks went back home. So that had the potential to be a super spreader event. Probably was. Bunch of people watching football. Of course, it's football in Europe, and it's a religion there. People pack the stands to watch, and European soccer fans are vocal. That's over. Well, there's also a heat wave in Europe. So maybe that's driven people inside. Maybe that's helping keep transmission low. Schools are out. Or maybe we haven't seen the surge because there's a little bit of a delay. Okay. Well, Freedom Day just happened. Maybe we're going to start seeing a surge a week after Freedom Day. Or maybe Britain's hitting herd immunity. Remember, Britain has, by the way, yes, there has been an increase in hospitalizations, but not to the degree that they saw several months back during their surge in the winter, mainly because of vaccinations, right? Again, they vaccinated seniors at a much higher level. And deaths, probably not going to see deaths nearly, not even close to what they saw over the winter. Again, because most of the people getting COVID right now are young people, low risk. You are going to see deaths though. Maybe it's because of this. Close to 70% of the population of the UK has at least one dose. plus the surge, you got a lot of folks who have Delta and antibodies to Delta. Have they reached herd immunity? And it's like almost forbidden fruit for us, for epidemiologists to say that. But it is a possibility. Again, I'd like to see this trend continue for the next week or so to determine that. It's interesting though. But yeah, it is a significant decline. Now, this decline was because the UK imposed severe restrictions. Okay, so after the winter surge, they imposed severe restrictions, and you saw a decline. And then you see the surge in Delta, again, steep decline. But the opposite's happening. They're removing restrictions. So it's very curious. I'm not going to say it's herd immunity, but it's a possibility. I'd like to see more data coming out of the UK before I make any sort of determination on that. It's promising. Again, keep in mind, if you think that this is going to happen in the US while avoiding deaths and hospitalizations, well, the UK has a much higher rate of vaccination than we do. Also, the UK's vaccination campaign was a little bit different. Remember, they, in some cases, delayed the second dose by weeks. I think the average second dose was after 8 to 12 weeks after the first dose. There's really strong evidence that actually increases efficacy of the vaccine by waiting even longer than 30 days. Interesting. Also, well, actually, I'll get to that point a little bit later. So anyways, curious things in the UK. Possibly good news. We just don't know. It's interesting, though. It's interesting. Okay. Let's talk about the US. We're seeing a surge. Bottom line. We're back to where we were about April, when a few states had a little bit of a surge. And it's still going up. Will we match the cases that we saw during the surge over the winter? Right now, the models show that we could, because we haven't peaked. Right now, the models show that we may not peak until September, October. The wild card here is school. Of course, here in the US, mid-August, mid-September, kids start going to school. Mostly kids who aren't vaccinated, going back to school. Many in states that have basically outlawed mask mandates. That's going to be a huge wild card. All right. We have seen an increase in hospitalizations, and we have not seen an increase in deaths, although they have started to increase a little bit. Again, I don't expect deaths and hospitalizations to see the heights that we saw during the worst days, but there will be deaths, and there will be hospitalizations. And here are the hotspots. Mostly the Southeast. So Missouri, Arkansas, Louisiana, Alabama, Mississippi, Florida, Texas, all seeing significant surges. Nevada to a lesser extent, rural parts of Oregon and Washington, rural parts of Utah and Colorado. On the flip side, things are really, really quiet in the Northeast. Pennsylvania, New Jersey, New York, the New England states, as well as the upper Midwest. Wisconsin, Minnesota, Michigan, the Dakotas are all doing okay in terms of numbers. Every state is seeing an increase, but the actual size of the increase varies dramatically. Slight increases in Vermont, significant increases in Florida and Mississippi. So this is a new map looking at risk levels for unvaccinated people based on cases and testing. And so you can see the purples is the extremely high risk, again, for unvaccinated. Okay, so you're looking at big swaths so this is based on case numbers, lack of testing, as well as the predominance of Delta and vaccination rates. So you can see vast swaths rural Missouri, Oklahoma, Kansas, Arkansas, Louisiana, the Mississippi, Alabama, Georgia, Florida, Texas, and unfortunately, big swaths of Utah and Nevada as well are at high risk. All right, so state by state. This is cases. So right now, Florida is leading the way in terms of cases per day. There are about 14,000 cases per day. California second at 8,000. But again, look at the per capita rates. You know, Florida is more than 3 times higher than California. Texas is third. Louisiana, Georgia. So yeah, that's the list. And again, notice, again, this is numbers. I think a better metric is per 100,000. If you look at per 100,000, Louisiana leads the way, 82 per 100,000. That's extraordinarily high. Florida's second is 66. Florida, it's unequal. Florida is driven by mostly the Panhandle area, which is very politically and culturally different than the southern parts of Florida, as well as the western shore of Florida. So I'll show you the Florida map in a second. Then Arkansas, Mississippi, Missouri. Again, there's this very strong trend. If you look at the fully vaccinated area, with the exception of Florida, these are states that are very lower than average vaccination rates. By the way, Utah's down here, but we're further down here. We're down by, we're doing slightly better than Tennessee. So I guess that's something to talk about. Anyways, we'll talk about Utah a little bit. So yeah, now if you look at the opposite end, again, with some exceptions, and the Dakotas are an interesting exception here, because they have extremely low vaccination rates. They have state governments that are been lackadaisical towards COVID, but they have very low rates right now. But the rest of the states, Vermont, 60% of their population fully vaccinated. They're doing extraordinarily well. They've seen an increase, but 4 per 100,000, that's not much. New Hampshire, Maine, Michigan, Maryland, Pennsylvania, Minnesota, Ohio. So a lot of upper Midwestern states and Northeastern states are doing extraordinarily well. They are seeing increases, in some cases, triple digit increases, but increases from what? I mean, they have very low rates to start with. My guess is that their rates, they will see surges, but will they be as significant as states with low vaccination? No. I mean, again, the UK is a cautionary tale. They had very high vaccination rates. They still saw significant surges. New England states will probably see surges, but not to the degree that, say, in Arkansas has. And I think this is the most important, they will not see hospitalizations and deaths to the degree that some of these other states have. So in terms of increases, you got Wisconsin, Mississippi, Rhode Island. Again, keep in mind, these are percentage increases. So, again, I think the best measure to look at is per 100,000. Okay, to look at the per capita rates. In terms of deaths, per day, and as far as counts, Florida and Texas lead the way, California, Missouri. And if you look at per capita, Nevada's number one, actually. Nevada has the highest per capita death rate right now. Then Arkansas, Missouri, Wyoming, Louisiana, Kansas, again, mostly low vaccination states. And that makes sense, okay? COVID is deadly to people without vaccines. Look at, I want to go through this fast because I want to go through the CDC's rationale for the new mask recommendation. So close to 190 million doses, but we've really stagnated. We're just really not vaccinating very fast right now. You break it down by age, it's a little bit better, 12 and up, we're, 66.9% with at least one dose. 57% fully vaccinated. You're hoping that the difference between, those folks that have at least one dose will get fully vaccinated, so the fully vaccinated will catch up. I guess the good news here is that 65 and up, the numbers are very good, okay? But still, 20% of those 65 and up are not vaccinated, not fully vaccinated, and at very high risk for hospitalizations and deaths from COVID. So that's not great. We have seen a slight uptick in vaccines per day. I mean, it's better than the decline or the same, but it's still not at a very high rate, about 615,000 doses a day. We were at about 500,000, so that's good. What I'm hoping is that the slew of news coming out about Delta, along with more and more vaccine mandates, for example, school, college mandates, university mandates, private companies are starting to mandate. A lot of tech companies are starting to mandate, or if not mandate, saying that if you don't get vaccinated, we're going to test you every week and you're going to have to wear a mask. So strong incentives to get vaccinated, because no one wants to have a Q-tip stuck up your nose every week. No, President Biden has ordered the federal government, all federal employees, to be vaccinated, which is going to have an impact on the U.S. because we have, I think, 40,000 federal employees in the state of Utah, between Hill Air Force Base, between the IRS, between the NSA data center. There's a lot of federal employees in Utah. So, and the VA, the military they're mandating vaccines for the military. By the way, I don't know why they haven't yet. I mean, the military, you're basically lined up and given shots. You're not even supposed to ask what they are. There's no informed consent, yet they don't want to impose COVID vaccines. That's weird. On a historical note, George Washington mandated smallpox inoculations for all of the Continental Army. Back then, it was literally giving people smallpox because the smallpox vaccine wasn't invented yet. That won't be invented for another 20, 30 years by Edward Jenner in the UK. So anyways, yeah, for those people who say, oh, that's never happened. Yeah, it kind of has. So anyways, so hopefully that will increase vaccinations. I'm hoping in the next month or so, the FDA finally gives full approval for Pfizer. And that hopefully will get those folks that narrowing percentage of folks who are still sitting on the fence about vaccine, get them vaccinated. That will also trigger vaccine mandates in many, many colleges. A lot of colleges are not mandating it until the vaccine is approved by the FDA, full approval by the FDA, including Westminster College. Once that happens, Westminster College will be the only college in the state of Utah with a vaccine mandate. So if you are a U student or a BYU student or a UVU student or a USU student and you're vaccinated and you're worried about going to school there, transfer to Westminster. I think that should be our new campaign. Yeah, so thank you, Amy, for that round of applause. Anyways, boy, yeah, actually, a lot of universities are imposing vaccine mandates even without full approval by the FDA, and I think we're in a legal gray area, and I can't really comment on legal issues and liability issues, but I do know that Indiana University imposed a vaccine mandate. They were sued by 6 students who said they violated bodily autonomy or whatever. I don't know. Anyways, the federal court shot it down. So there's some legal precedent. But yeah, and also there's some legal gray areas as to whether you can impose vaccine mandates on employees. And so this is kind of new ground here. It'll be interesting. So a lot of colleges are imposing vaccine mandates on students, but not on their staff and faculty. Luckily, Westminster College, the last survey we did, and we had a really good response rate, like 40-50% response rate. 92% of our campus community was vaccinated. And this was several months ago. This was at the beginning of summer. So I feel really confident about the protection, at least, the Westminster community. Anyways, state-wise, vaccinations, Northeast, West Coast, Upper Midwest, good. Southeast, parts of the Intermountain West, not great. And those trends haven't changed. And you can see clearly it's also a very rural-urban divide. Urban areas much more likely to be vaccinated than rural areas. And then, of course, as has been talked about ad nauseum, very much a political split as well. And you can see that clearly here. Even Utah, Wasatch Front, particularly Salt Lake County, Summit County, pretty high levels of vaccination. The rest of the state, with the exception of, say, Grant County, not so great. All right. And again, nothing changed here. I mean, it's just extraordinary differences in vaccination rates. The good news is, maybe if you can call it good news, is that the 65 and over vaccination rates are very, very high. Just about every state, even the lowest levels. Well, I thought I was going to say 80%, at least 80% of the population is vaccinated, but way to screw that up for me, Wyoming and Mississippi. They're at 78 and 79%. So that means 20% of a very highly, highly at-risk population do not have vaccines. These are all preventable deaths at this point, all preventable hospitalizations. In some states, holy cow, Hawaii and Vermont, almost all of their seniors are vaccinated. So kudos. Massachusetts is up there too. Connecticut. Again, if you look at the just looking at this is sorted by 18 to 64. Utah's not doing terribly. We're better than Mississippi, which is something, I guess. But yeah, I mean, Utah's doing not too terribly. I was talking to some folks about this. I heard a comment by a BYU professor saying that he's surprised that, given the culture of Utah, that our vaccination rates aren't higher because of the influence of the church and the history of Utah, and the settlement of Utah was so different than the rest of the West. So yeah, rugged individual and blah, 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 but it's also balanced by this kind of almost socialist, this group identity with the church. So it's a little bit surprising, but I think, to me, that kind of also lends power to the overt politicization of COVID too, how powerful that is. So anyways, yeah, but these states are doing well. Those states are probably going to do very well in terms of surges, but because of Delta. You will see surges in those states, I think. Again, cautionary tale out of the UK and Israel. You will see surges, but you will not see surges of infection, but you're not going to see significant surges in hospitalizations and deaths. I think that's really important. And I'm going to start differentiating infection versus disease. Now, I had a really long post about this, and I think this is really, really important. And a lot of the challenges right now, especially with all the changes with COVID, is a communications challenge. So I'll get to that in a second. So this is a public health research institute actually did a study on vulnerable to infection with Delta. And they created this map. The New York Times created this map. So the darker the color, the more you are at risk for Delta. This is based on a whole bunch of metrics. Percentage of Delta in the state, vaccination rates, incidence rates, et cetera, et cetera. And you can see that, again, Missouri, Arkansas, Louisiana, the Southeast is really kind of dominating this. Northeast, not so much. Upper Midwest, not so much. And even parts of Utah, particularly the Wasatch Front, not so much. You look at the Western states, there's definitely a huge difference between urban areas and rural areas. So, Washington State, I always joke that you're two different states. You got the Puget Sound area and the rest of the state. Very different culturally and politically. And it kind of reflective of here as well. Same with Oregon. You have Portland, Eugene, Salem area, and you got the rest of the state. It's not surprising that Oregon, for years, rural Oregon has been trying to pass this bill to secede from Oregon and join Idaho. Yeah, I know. Weird. Anyways, yeah. So in those states, you're going to definitely see this very political, urban, rural, but also political divide, which, again, those are almost the same thing too. All right, so individual states to go through quickly. Florida is now, look at the new cases. They've set a record of new cases, far exceeding the record they set over the winter. It's bad. And again, it's regional. Yes, Florida has a fairly high number of, they're about national average in terms of vaccination. But again, you see where the surges are. The hotspots are in the Panhandle and the northern region, which is very different than the rest of Florida. The Floridians oftentimes joke the Panhandle area is just it's a South Alabama. It's closer culturally and politically to Alabama and Mississippi than the rest of the state. So Florida is a very diverse state. So yeah, it's surging, but it's driven by mostly rural areas with low levels of vaccination. So you can see hospitalizations have spiked significantly. Again, I emphasize most of those hospitalizations, almost all those hospitalizations are in the unvaccinated. Missouri is also still going through a surge. Okay, not necessarily much in the St. Louis area, but mostly, or Kansas City area, mostly in the rural areas, centered right around Branson, Missouri. Okay, and again, you see the hospitalization. There are hospitals that are completely overwhelmed right now in rural Mississippi. I mean, as well as Arkansas, completely overwhelmed. You know, basically the same horrors that we saw over the winter. Same with Arkansas. You can see, again, they're quickly approaching their peaks as well. Again, mostly in rural areas, although you could argue all of Arkansas is very rural. There are no really major metropolitan areas in Arkansas, with the exception of maybe Little Rock. But you can see, again, hospitalizations have increased and deaths have, again, peaked a little bit as well. Again, mostly in the unvaccinated. Louisiana has exceeded. I mean, their average has exceeded the peaks, and they're still going up. So Louisiana is going through a really hard time. Their hospitals are spiking as well. The hospitalization numbers are spiking as well. Alabama is starting to spike hard. Mississippi spiking hard. Again, Mississippi also broke a record in new cases per day, again, exceeding the peak that they saw over the winter. Texas is starting to peak. And of course, Governor Abbott and this is exactly what I told the Deseret News, that state governments are going to double down. Is this so politicized? They're not going to say, oh, hey, we need to impose mask mandate. They're going to double down. And that's exactly what Texas did, is they doubled down. Governor Abbott just signed a bill basically banning all local mask mandates. So I'm afraid Texas numbers are just going to keep going up, because that slope there is awfully steep. Given what we're finding out about Delta, and I'll get to that in a bit, it's concerning. Georgia's starting to peak. Again, mostly, it seems like mostly in the rural southern area. Atlanta, not so much here, mostly in the rural southern areas. On the flip side, there's Vermont. Yes, Vermont's seeing a surge. Yes, it's not very big. Okay, so percentage-wise, that might seem big, but a percentage of a very small number is still a very small number. Vermont's still doing very, very well, even though they are seeing a bit of a surge. And again, surges are going to be expected even in highly vaccinated New England and upper Midwestern states. Okay, again, refer to Israel and UK. High vaccination rates still saw a surge. Okay, but again, you probably won't see the hospitalizations and deaths that we saw earlier. And that's the important point. Minnesota, still, again, we're seeing a little bit of a surge, but not very big. Okay, still doing quite well. Pennsylvania, big state, doing extraordinarily well. Yes, seeing an increase, but not to the degree that other states have. So, US observations. We are seeing a significant increase nationally, and with every state is seeing an increase in incidence, but it's very, very regional. Okay, southeastern states, significant increases, and a few other states in the Mountain West. Okay, number of new cases are now in some states have exceeded the peak we saw over the winter. It's all driven by Delta. The vast majority of new cases in the US is the Delta variant. The Northeast and upper Midwestern states have seen increases, but again, increase not very big, okay? Deaths are not spiking. yet, but it is a lagging indicator. We do know hospitals are becoming overwhelmed, including in Utah. ICUs are starting to fill up again. Okay. And there's a clear correlation between vaccination rates and surges in new cases. It's a clear correlation, but unfortunately, vaccines are mostly stagnated right now. We're just having trouble getting people vaccinated. Let's quickly go over Utah numbers. Yeah, it's definitely up. Not to the degree of, say, I keep saying this, and I'm not saying that Mississippi, I don't want to compare ourselves to Mississippi and Alabama. Much rather compare us to Vermont or Hawaii. But this is what it is. We're better than Mississippi. Not quite as good as Vermont. But we are seeing a surge. We are definitely seeing a surge. Not as significant as some other states, but definitely a surge. We're definitely seeing hospitalizations increase. Like I said, Intermountain Healthcare is reporting that their ICU is getting full again. We're reaching capacity again. Luckily, deaths have stayed low, but Utah's never really had a problem with COVID mortality because we're such a young population and because of the quality of our healthcare system. So we haven't seen, but this may be also because of the lagging indicator. We may still see a surge in death. Again, mostly among unvaccinated. County-wise, Salt Lake, of course, is number one in terms of count. Utah County is very closely behind. Of course, all the Wasatch Front counties are first here. To me, the more interesting one is the per capita. And you can see that actually Salt Lake's about middle of the pack in terms of per capita. We're 19 per 100,000. Whereas Duchesne, Uintah, Wasatch County are quite high. Iron County, Utah, of the Wasatch Front counties doing the worst, Utah County is leading the way. Not coincidentally, the Wasatch Front County that has the lowest level of vaccination. So, in terms of increases, Morgan County, Duchesne County, Cache County is all seeing increases, Garfield County. So mostly rural. So if you look at per capita, it's mostly driven by rural counties. Okay. Yes. Well, even in the Wasatch Front, we're seeing increases, but not to the degree that we're seeing in the rural counties. In terms of hospitalizations, Washington County is now number one in hospitalizations for COVID. It's not entirely surprising given that it is an older population, the oldest population probably in the state. Maybe Summit County is slightly older, but because of retirees in Washington County, it's not terribly surprising that their hospitalization rates are the highest. Kane County, Iron County, Grant County, Wasatch, again, mostly driven by rural counties. Salt Lake County is up there, but not all that high. So, and then in terms of deaths per capita, Kane County, Uintah County, Millard County, Box Elder, Tooele, Washington, Davis, and then Salt Lake. So again, mostly it's this surge, if you just look at it from a per capita, where the hotspots are, they're in rural counties. Here's a surge, a little bit more detail. You can definitely see a surge there. It's definitely increasing. Test positivity has gone through the roof. This is test positivity, and it's now above 10%. So it's really gone on. This is a real surge. It's not an artifact of testing. It is a real surge. Our testing is still low. I'd like to see it increase more, but it's definitely a surge. And hospitalizations are definitely increasing as well. Okay. And this is deaths. Deaths so far are level here. Will we see an increase? We'll see. Deaths are of course a lagging indicator. This just shows it's all Delta all the time now. Every time I go by the airport and I see a Delta plane landing at Salt Lake International, I just keep thinking, oh, airborne Delta. I don't know. I'm sure Delta Airlines does not want that association, but okay. So it's all Delta all the time. It's just basically right now, the vast majority of new cases is Delta variant. Again, makes a lot of sense from an evolutionary biology standpoint. The ability to transmit, the ability to spread twice as fast as any other variant, that's a pretty big evolutionary advantage. So this is not entirely surprising that it's all Delta all the time right now, and it is. So you can see, starting right about the beginning of June, Delta just took over and just rapidly became the predominant variant. In terms of vaccinations, we're kind of the same as nationally. We're kind of stagnated. We're making progress, but very, very, very slowly. Like we went up from 56.3% of our population totally vaccinated to 56.9%. Whole 0.6% increase in 1 week. Not great. Not great at all. Our rate of vaccination has really not increased. We're about maybe 6,000 or 7,000 doses a day. Just people aren't getting vaccinated right now. You look at the vaccination by county. Again, Summit County is tops at 68% fully vaccinated. Then Grant County, Salt Lake County is doing okay at 51%. Then Davis County close behind there. In terms of Wasatch Front counties, Utah County is doing by far the worst at 36%, which makes me feel a little bit nervous living technically in Wasatch, technically in Utah County, even though I'm in the city of Draper. And then Juab County. Don't know what they're doing, but only 25% of their population is vaccinated. Not great. 25%, sorry. Wow. And you look at small area, again, mostly the areas with high levels of vaccination, this Park City and mostly the East Bench of Salt Lake City. And a few exceptions. This is Summit County, Wasatch County, I believe. And then Grant County has high levels of vaccination. And of course, San Juan County has high levels of vaccination, mainly because of Indian Health Services and the Navajo population there. The rest of the state, really, really low levels. Particularly this corner here, very low levels. By age group, it's of course the younger populations that are really driving this. Now, there is some promising trends here, and that is this lowest age group, 12 to 18. Looks like that curve is getting a little bit steeper. So it seems like more and more parents are realizing, hey, I'm going to get my 12 to 15-year-old vaccinated before going to school. I think that should be the big push right now, given that mask mandates are, can't be imposed, and it's the source of a huge amount of just conflict for some reason. So anyways, so that's some promising news. But again, we need to get these younger populations vaccinated. Again, those of you in public health belief model, perceived benefits, perceived risk, self-efficacy, we need to change that balance. We need to change that balance of incentives, carrots, sticks, encouraging people to self-efficacy, just not doing a good job with the younger populations. I think the perceived risks are probably the issue, and perceived benefits. So in terms of breakthrough infections, so again, I applaud the state of Utah for actually publishing this. Yes, there are breakthrough infections. Yes, they're going to happen. We knew this all. So we need to get used to the fact that fully vaccinated people are going to get COVID. Now, we need to really clarify. This is one of those really challenging communications issues. Again, I had that long ass post a few weeks ago or a week ago on Facebook about the difference between exposed, infected, diseased. And I think that's really, really, really important, because we think when we say we get COVID, no one really quite knows what that means. Does that mean you test positive for the virus? Does that mean you show signs and symptoms? Does that mean you're in the hospital? Does that mean you transmit the virus? And there's a lot of, it's not as clear cut as you think. And that's one of the challenges of COVID right now. Okay, and we'll get to that in a second. But definitely, we're going to get breakthrough disease. I'm going to start calling it breakthrough disease, and I'll tell you why in a second. Right now, we can see that's much higher. This is incidence. These are reported cases of COVID. So probably folks who are tested because testing is required, or they end up in the hospital. So this is mostly probably symptomatic folks, not infection. People with symptoms who ended up in the hospital or got tested for whatever reason. According to this data, by the way, it's the vaccine efficacy effectiveness is about 82%, roughly. Okay. But there's some vaccine. We'll revisit this in a second. Okay. Utah observations. Let's finish up the Utah observations. There's definitely significant statewide increase in new cases. Not as high as some states, but definitely seeing a surge. Hospitalizations and test positives also increasing. So this is a real surge. Deaths are still low and probably will stay low given our vaccination rates in seniors, but we'll definitely see a little bit of a surge in deaths. There's definitely a strong correlation between vaccination and new cases. So again, counties with higher levels of vaccination aren't seeing this. Their surges are smaller than others, and then areas with low levels of vaccinations. And overall vaccination rates have stagnated. We're just not vaccinating enough people, which is a problem. Okay, let's talk about the big news, which is the CDC's new recommendations on masks. They are now recommending that everyone indoors, that everyone wear masks, regardless of whether they're vaccinated or not. So prior to this, they were only recommending folks who were not vaccinated to wear masks indoors. Now, this is only in areas that have substantial or high transmission, as outlined by the CDC. Also, folks with further risks to COVID, regardless of vaccination status, so seniors, people who are immunocompromised, or people who are exposed to people who are immunocompromised or at higher risk, to wear masks as well. And they recommended universal masking for all teachers, staff, students, and visitors to school, regardless of vaccination rates. Now, when this came out, there was a lot of confusion, even among us public health folks, because we were, why this sudden change all of a sudden? We know Delta's going on, but where's the data? Or was this, there was lots of theories. Was this an admission that our previous mask recommendation that unvaccinated people don't wear masks, or vaccinated people don't have to wear masks, were they going back on that? Was it some sort of encouragement to get people vaccinated or not to get people vaccinated? It was really confusing. But the CDC has actually released some data. Now, before I get to that, here are the key points of this. And you can read this. This is on the CDC, but I think I went over all of the key points that, again, everyone wear masks in areas of substantial or high transmission, regardless of vaccination status. And even in people with low to moderate transmission, even if you're vaccinated, you should wear a mask if you are immunocompromised or you're high risk or you're exposed to people who are at high risk. And given that, again, no one under the age of 12 is vaccinated, all students, faculty, staff, and visitors at schools should be vaccinated. Now, what is the determination as to whether you should wear a mask or not? Well, there's a map by county of areas with substantial or high transmission. So anything red is substantial or high transmission, red or orange. Blue is low and yellow is moderate. So in low and moderate areas, the old recommendation stands. If you are vaccinated, you don't have to wear a mask. However, in most of the country, that's not the case. Most of the country, you basically say, where the CDC is basically saying, if you're indoors, wear a mask. Doesn't matter if you're vaccinated or not. That includes Salt Lake County. Salt Lake County is considered high transmission. That is, I believe, Summit County, which is considered moderate transmission, where you don't have to wear a mask if you're indoors, if you're vaccinated. And there's a few other counties, blue, I think Wayne County, Paiute County, a few other counties, Daggett County, where it's low transmission. And again, indoors, if you're vaccinated, you don't have to wear a mask. So, why did the CDC make such a dramatic change? Now, this was a real risk because, again, communication is the biggest challenge. And unfortunately, a lot of folks see changes in policy as being wishy-washy, not that the science changed, the facts change and we have to change our recommendations. Unfortunately, a lot of people say you're just being wishy-washy or there's another agenda. A lot of people who are vaccinated saying, why should I have to do this again when I've been doing the right things? Now I have to wear a mask again. This is kind of a mess. And again, I'm not saying I have the answers because this is from a communication standpoint. This is so challenging. How do you communicate this very sudden change in policy to a population? And also, a lot of us thought, well, this isn't going to do anything. I mean, come on. I mean, you walk into a Home Depot or Walmart's in an area with maybe 40% of the population's vaccinated and no one's wearing a mask. So are you assuming, so basically, what are the chances that everyone in that store is vaccinated? It's standard binomial, very simple, basic biostats question. I'll probably include in my biostats class. It's almost a 0% chance. So, yeah. So is this actually going to do anything? In fact, you know, Texas and a few other states, they've actually doubled down on this. So what is driving the CDC to make this decision? So we didn't see the science. They mentioned that, oh, even vaccinated people can spread virus. Even asymptomatic vaccinated people can spread virus. Well, where's the data? Well, the Washington Post released this presentation. That was an internal presentation made by the CDC that's been going around internally. So I don't feel bad sharing this because it's already been outed by the Washington Post. It's a scientific presentation meant for public health folks and epidemiologists. So a lot of it's very technical, but there's some really, really concerning data. And I can see why the CDC's changed course. So a lot of this is basically the challenges of communicating a lot of this. Okay. And so it talks about the communication challenges, but there's also some fascinating data on vaccine efficacy that they have, particularly in at-risk groups, and the potential for Delta to spread among the vaccinated. Okay, the first thing that they talk about is breakthrough cases are going to erode confidence in vaccines. This is why we have to normalize the fact that we will have breakthrough infections because vaccines are not perfect. It does not mean the vaccines aren't effective. They are. They're incredibly effective. So we need to emphasize that, okay? Vaccine breakthroughs are probably more likely if you're immunocompromised, you're older, you're higher risk, or you go to a lot of frequent, potentially high transmission events, okay? So vaccine efficacy has been very stable. It's been very good. But again, every time there's a breakthrough case, and unfortunately the media doesn't help because they always harp on the breakthrough cases. I pick on the New York Yankees because, Jesus, they can't seem to prevent COVID because they're always getting breakthrough cases. The problem with that, this is a lot, or you hear this, these stories about a wedding where everybody was vaccinated, but there were still 5 cases of COVID among everyone who's vaccinated. So you think, oh, everyone's vaccinated, but there's still 5 cases? Vaccines don't work. There's various reasons, some of it technical, some of it not so technical, where that's the case. Okay, so this communications issue is something that the CDC is really aware of. But really, right now, you look at this graph, you look at COVID incidents per 100,000 among the green is unvaccinated, the blue is vaccinated. And you look at the difference. Vaccines are still incredibly effective. Oh, 1,200 cases today in Utah. We're still going up. It's incredibly effective. But at current incidence, about 35,000 symptomatic infections per week among 162 million vaccinated Americans. Stuff like that is going to people are going to think, holy crap, vaccines aren't effective. But you look at 162 million over 35,000, that's actually, from a math standpoint, it's highly effective. Now, there's also increasing hospitalizations among vaccinated people. That is concerning. Why is that? Well, again, those who are seniors, those who are at high risk, are more likely to get breakthrough infections and end up hospitalized because they are at high risk. Also, given the high number of people that are vaccinated in that group, the chances of breakthrough infections are higher. So this is it's kind of counterintuitive. But as you increase the rates of vaccination in a population, there's going to be more breakthrough infections because there's more vaccinated people than unvaccinated people. So you're going to get a lot more breakthrough infections than maybe regular infections. And people are going to correlate that to saying, oh my God, the vaccine is not effective, when in fact, it is just statistics. There are more vaccinated people than unvaccinated people. So even though breakthrough infections are really rare, you're going to get more breakthrough infections just because there's more unvaccinated people than unvaccinated people. Okay. If you have a population of 100 where 99 people are vaccinated, one person is unvaccinated, and two vaccinated people got the disease and the one unvaccinated people got the disease, people are going to say, oh my God, vaccination doesn't help. You got two people who are vaccinated got a case versus one unvaccinated person. And anybody knows from a basic statistics standpoint, that's apples and oranges comparison. That is a completely logical comparison to make. But a lot of people are making that comparison because you hear about breakthrough cases in populations that are largely vaccinated. So anyways, basic epi, right? All right. So this data shows that vaccine effectiveness is indeed, it's less effective in at-risk population, which again, makes sense. In the vision, this is the healthcare, these are infections in healthcare workers, against hospitalization, 88% effective, no evidence of waning immunity. So in healthcare personnel, vaccination efficacy is very good. However, in immunocompromised patients and seniors, it's lower. And we have now real-time effectiveness data to show that it is indeed lower in immunocompromised patients. 71% against infection. Okay, 90% overall though. This is after the first dose. 80% against infection after 7 days after the second dose among people on immunocompromised medication. So pretty good, but definitely lower. We knew this. Okay. In fact, if we're going to talk about boosters, we need to focus on this population, not everyone. And then among nursing home residents, it's lower. It's an at-risk population. So 75%, 74%, 75%. We expected this. Why? Because these are at-risk population with their immune systems are not as strong. They're in nursing homes, they're seniors, they're at high-risk population. So it's less effective. So even among fully vaccinated folks, it is less effective in these populations. Therefore, they still need to be protected from infection because vaccines are not going to protect them as fully as in healthy folks. So that's one point that's really important to make. We need to protect these folks. Okay, and from exposure. Okay, we need to protect those folks from exposure. Because of that, even if they're vaccinated, they're still at higher risk than everyone else. Okay. So anyways, by the way, this is kind of an interesting graph. I should go over this a little bit more. I don't have time. But again, it just shows that the higher the level of population that is, the higher the percentage of a population that is vaccinated, the more likely breakthrough infections occur. Again, that seems counterintuitive, but it's a statistics game, just like my previous example. Okay, so this is a really nice graph that kind of shows that. Okay, and I wish I could explain this more, but I just don't have time. I need to get through the rest of this. Again, communications risk though. This is definitely a communications issue because people think I got vaccinated, I'm safe, or I'm not safe. It's not a binary, safe or unsafe. It's a continuum of protection, and that's been a really hard point to make. I think binaries are much more easier to communicate when in fact in real life there are very few binaries. Everything's a continuum. But that's much harder to communicate to folks. That's true with vaccine protection. The other problem is the Delta variant. And this is the big news. So before I get into Delta variant, I want to again go over the difference between infection, disease, exposed, infection, and disease. Exposed means you are exposed to the virus, the SARS-CoV-2 virus. You are exposed to it. You may have inhaled it. Okay, but there's a potential to get to the next step, which is infection. So exposed is you have been exposed to the virus. A lot of times we're exposed to the virus, doesn't do anything. Okay, infection is the next step. So you're exposed, and then the virus starts to enter your cells and starts replicating. That's infection. That is a technical term for infection. Okay, now you got to be exposed to obviously get infected. Okay, now the next step after infection is disease. Disease is when you get enough virus to take over your cells and you start showing signs and symptoms. That's disease. Okay. And then, of course, there's different stages of disease: serious disease, hospitalization, death, and so on. But those are the three, I think, important points to make. It is a continuum. It is not a binary, whether you have the disease or not, because there's people are unclear about, well, asymptomatic infection. Is that disease? It's a good question, depending on your definition. For a lot of public health folks, if you're not hospitalized, if you don't have symptoms, you're not diseased. You're not a burden on the healthcare system. You're going to recover. You're fine. However, from a public health standpoint, here's the problem. Infected people could potentially spread the disease. Okay. Again, you may not show signs and symptoms because your immune system may be fighting it off, but enough virus has replicated inside your cells that you can still spread the disease. And that's where this complication comes from. And this has lots of implications for testing, for what is disease? What do I mean by getting COVID? Vaccine efficacy, is that towards hospitalization, symptoms, or infection? There's a lot of unclarity about this. I want to make a point. Vaccine efficacy is measured towards disease, symptoms. When I was in the clinical trial for AstraZeneca, I was not tested every week for infection. They only said you'll get tested if you show signs and symptoms. So obviously the endpoint is disease, not infection. So the efficacy that's calculated is mostly for symptomatic disease, not infection. If I was I don't know, I may have had COVID, but it was asymptomatic. I was never reported. So all the vaccine effectiveness, efficacy numbers coming out of the clinical trials is towards vaccine, is towards disease. And that's going to be typically higher than infection. Okay. Now, the idea, the thought was that, if you're infected, you just don't have the viral load to get sick. So therefore, you probably don't have the viral load to spread the disease. But with Delta, that may not be true. So number one, transmission versus Delta. So this is R naught, this x-axis. The y-axis is fatality. So this is where SARS-CoV-2 is. This is why we say it's now as transmissible as chickenpox. Far deadlier than chickenpox, but about as transmissible. It's more transmissible than smallpox, polios, Spanish flu, SARS, SARS-CoV-2 ancestral strain, which is the original variant, MERS, et cetera, et cetera. Okay, so yeah, it is much more transmissible. Probably due to why? Why is this more transmissible? We think it's because viral load's higher with SARS-CoV-2, with the Delta variant. Okay, Delta variant is now been associated with higher viral load and duration of shedding, and this is published evidence from India. They reported that lower cycle threshold values with Delta breakthrough cases. Now, a little bit about cycle threshold value. That's a technical term. PCR, reverse transcriptase PCR, is the way we diagnose disease. Okay, and what that essentially does is takes a sample from you, okay, and if there's any segment of the SARS-CoV-2 virus in there, it amplifies it. It just basically starts making copies of it to a point that basically the primer can detect it. So that's so PCR is just basically heating, cooling, heating, cooling, heating, cooling, heating, cooling. And every cycle of heating and cooling, the number of viruses or the virus segments doubles. Okay. So that's why it's so powerful. You can double it and you can detect very minute amounts of genetic material. So that's a cycle threshold. So how many cycles? So if you don't have to amplify it very much before it can detect it, that means there's a lot more viruses there. That means viral load. So lower cycle threshold numbers means higher viral load. So that's what this says. So that's a number that we should really start to incorporate when we do PCR testing, because most PCR tests give you a binary answer. You have it or you don't. But if you have it, the cycle threshold is really useful information because it tells you, okay, how much virus is it? Anyways, what they found was with Delta, much lower cycle threshold, meaning that higher viral load. Okay, especially in the nasal passages. Also, duration. So you have longer duration of CT values less than 30, which is, again, very high viral load for longer time. So 5 more days, you're basically infectious for longer. So you have more viruses, you're infectious for longer. That equates to increased transmission. That was published data. Now, this is unpublished data. Now, that was for cases of Delta. This data, again, this is why it says confidential preliminary, not published. This is showing that breakthrough cases have lower CT values by 3 cycles, tenfold increase in viral load for Delta compared to Alpha and other lineages. So Delta is associated, breakthrough case of Delta is associated with much higher viral load. So yes, if you are a breakthrough case, you're spreading COVID. Okay. Another concerning study out of Barnstable County, Massachusetts. There was a huge outbreak in Massachusetts, mostly among the vaccinated. In fact, Provincetown, which is on the tip of Cape Cod, is a huge vacation spot. They had a huge surge, mostly among the unvaccinated, excuse me. And so what they found here was that there was no difference in CT values in vaccinated and unvaccinated cases. So unvaccinated cases and the same viral load as vaccinated breakthrough cases. So vaccination didn't seem to lower viral load, at least in the nose. Now, here's the thing. It still is very, very effective at preventing disease. So what the vaccine does is maybe perhaps doesn't do a good job on infection. It does a phenomenal job in preventing infection from becoming disease. But from a transmission standpoint, that's not good news, because that means that even if you're vaccinated and you get asymptomatic disease, you're still spreading the disease. So this is why. Also, there's some evidence that Delta causes more severe disease. This data to me is still a little bit unclear, but it makes sense from a virology standpoint. Higher viral load means more chances of disease. Okay. And finally, Pfizer dose vaccine efficacy for Alpha versus Delta. There's definitely a reduction in efficacy against Delta compared to Alpha. So slight decreases. So the dot here is Alpha, the triangle is Delta. So you can see against hospitalization, still highly effective. Against symptomatic disease, highly effective. A little bit reduction in England, a little bit reduction in Canada. This is interesting. Israel is showing very different data. Now, I think our local epidemiologist, she did a really nice job of actually outlining this. That makes a lot of sense. To me, the differences in vaccination regimen may explain this as well. In Israel, everybody got Pfizer. Seniors, young people, everyone got Pfizer. In the UK, because of the concerns about AstraZeneca in young people got Pfizer, seniors got AstraZeneca. AstraZeneca is less effective, and therefore the chances of breakthrough infections are greater. So that could, I don't know. I mean, there's a lot of other reasons too. Israeli data, I still haven't quite seen it. Also, Israel has a high number of people vaccinated. So again, more chances of breakthrough infection because of the number of people vaccinated. There's a lot of reasons why that could be the differences there. I'll try to talk about it a little bit more, maybe on a post or a video later. So anyways, this is why they decided to reimpose the mask mandate. Okay, so this is actually a really interesting graph here. This is different scenarios, different models of transmissibility. This y-axis is probability of increasing transmission. X-axis is vaccination coverage. And these different scenarios, this is R naught of 5. This is closer to delta, R naught of 2.5. That's alpha. So if you look at alpha, natural immunity about 5%. Okay, we don't have 35% natural immunity. So natural immunity 5%. You can see that with vaccine coverage of about 60%, really, if you just mask only the vaccinated, that's going to do a good job of reducing risk. However, with a far more transmissible disease, and also given that vaccinated people can spread it, all of a sudden the scenario, this is basically, this gray area is basically no masking at all, or all masking. So this area, this is masking vaccinated only, unvaccinated only. This is masking everyone. This is no masking. So again, it just shows, and I apologize. I wish I could get into this more because it's a really fascinating graph. It just basically shows that the metrics change given the increased transmissibility of Delta that we do, given that we're only at 60% vaccine coverage with 5% natural immunity, we have to mask again to prevent increases in transmission. Everyone, not just the unvaccinated. Now, if we got up to about 80%, that again changes the metric again. We may only have to have the unvaccinated mask. But given higher transmission levels and 60% vaccination, simply put, we have to vaccinate everyone to prevent transmission, especially given what we know about viral loads in breakthrough cases. So this is their summary. And I'm sorry, I'll try to clarify this a bit more and put out a more detailed post on this. I don't think I was very clear on this. This was breaking. I just got this morning, just downloaded it off the Washington Post website. So I was just like trying to think up a presentation. And again, this isn't my presentation. So apologies to the CDC for butchering their presentation, but hopefully, I think they're going to share this nationally. I think they are going to release this data, and they really should have released it the same time they presented this. But yeah, Delta is more contagious, possibly more severe, and breakthrough infections may be as transmissible as unvaccinated cases. My guess is breakthrough infections are far more common than we think. Okay. Again, that does not mean the vaccine's ineffective. I would say it's very effective, particularly against against symptomatic disease, hospitalizations, and deaths. It does not mean it is ineffective. Again, that's just a communications issue. We need to start talking about the difference between disease, infection, disease, exposure, infected disease. We need to start clarifying those points. That infection, does that actually mean disease? Should we start calling things breakthrough disease instead of breakthrough infection, which just confuses everybody? It's a good question. Vaccines are still extremely effective at preventing disease, possibly not as effective at preventing transmission. Okay, so there's more breakthrough, more community spread despite vaccination. It's just going to happen. So therefore, in the short term, masks may be necessary to offset the fact that Delta is this much more transmissible, even in breakthrough cases. Long term, the long-term solution is still the same: vaccinate. If we get 80, 90% vaccination coverage, we wouldn't be having this discussion. And I could have Fridays noon times to do what normal people do on Friday noon times. I don't know, eat lunch, go off for a motorcycle ride. I don't know. I don't know what that even, I have no idea what people do. Well, you all are here, but I don't know what normal people do if they don't do that. I would like to find out what people do Friday at noon, but we're not there. So the long-term solution is still valid. Vaccines are effective at preventing disease. It does not change the solution. That is vaccinate. Okay, long-term. So this mask mandate may be necessary. We need to think of this as short-term because number one, it may not work. And I'm kind of pessimistic about whether anybody's going to change their behaviors based on this. The people who are going to change their behavior already are being careful. They're vaccinated. They're ones that are up on this stuff. The folks that we need to reach, I don't know if we're going to actually reach them. In fact, there might be a backlash here. Okay, this is a short-term solution. Long-term, however, vaccines. Okay, and honestly, mask mandates, we have a shrinking level of patience from the public for any sort of mandate. Mask mandate might push them over. So if we're going to really if we're going to mandate something, mandate a permanent solution, and that is vaccine mandates. That is my opinion. That's a little bit editorial, I know, but really, let's not even waste time with mask mandates anymore. Short term, maybe to prevent this surge, because obviously vaccines take a while to take hold, and we won't see the effects of vaccines for a while. Go straight to a vaccine mandate. We're already starting. The president is frustrated, visibly frustrated. He's imposed vaccine mandate on federal employees, the military. A lot of private companies are starting to do it. A lot of colleges and universities, at least ones that aren't, ones in states with, that are rational about COVID, are doing it. We need more though. Travel restrictions, they should stay in place. Airlines should still require vaccine passports. Ships should require vaccine passports. Again, these are outside of state laws, and therefore they still can do it. We can do this even as states move toward these asinine state rules against mandate. It typically does not affect private companies. It does not apply to the federal government. So we can impose enough vaccine mandates that it doesn't impose on people's so-called freedoms, but at the same time, it makes it inconvenient enough that they will actually get vaccinated. So that's really my solution to this. Mask mandates, short term, okay. I'm going to wear a mask. I just canceled my housewarming party again for the second time. And I'm going to wear a mask in public again. However, long term, we're not going to get through this until we get more people vaccinated. So sorry, this was a little bit less clear. I apologize. This is a lot of information, and it just got dumped on me this morning and last night, and trying to, this isn't a slick YouTube presentation, unfortunately. It is me just kind of talking off the cuff. None of it's scripted. So I apologize. I'm going to try to kind of clarify my thoughts and maybe come out with a more coherent post about this, because I think this is really some important information, particularly, again, back to the point about infection versus disease, and how infections, you can still be transmissible in Delta because the increase in viral load. If you're infected with Delta, even if you're a breakthrough, you're still spreading it. But again, the challenge of that is, okay, yes, you're infected, you're spreading the disease, but it's still highly effective at keeping you out of the hospital, keeping you from getting symptoms. That's a huge communication challenge. So, all right. So if you have any questions, please feel free to shoot me an email. Otherwise, I'll let you go for this Friday. I have a very busy afternoon of going to the dump and Home Depot lined up for this afternoon, so I'll let you all go. Otherwise, I will see you next week. Yeah, next week definitely, because I got to be on campus, and I'm sure there's be more news to cover. So, and again, I hopefully I'll clarify some of the major points here after I kind of sort out my thoughts and come up with a more clarifying post about the CDC presentation. Also, I think the CDC is going to present this data as well, so I'll have to look that up. So, all right, thanks very much. Thanks for coming. I appreciate your time and your patience, and I will see you next week.